Dr. Richards had allocated 5 minutes for the elderly patient, Charles. "Signs of aging," he said indifferently. But when Nurse Jennifer opened the medical records, her breath caught. Purple Heart, Bronze Star, wounded 3 times in Vietnam. "Doctor," she said, trembling, "you need to look at this man's file." That day, Dr. Richards learned how he had disrespected a hero. Charles Chuck Davis, 78 years old, came to St. Mary's Hospital's emergency department that Tuesday morning just wanting the pain in his leg to go away. This increasingly worsening pain over the last 3 months was now making it difficult for him to even walk. Charles was a humble man. He had come to the hospital in his old model Honda Civic, wearing worn but clean clothes, gray pants, navy shirt, and worn but polished shoes. A typical elderly American, respectful, patient, and the type who didn't complain much. St. Mary's Hospital was a community hospital serving a middle-class area in Chicago's southern suburbs. Neither a luxury private hospital nor an inner-city trauma center. Just a reliable healthcare institution where neighborhood families went, one that accepted insurance. Dr. Marcus Richards, who was on duty in the emergency department that morning, was 29 years old, fresh out of residency, and a young doctor who wanted to advance quickly in his career. Marcus was very confident, sometimes overconfident, and especially tended to view elderly patients as routine cases. "Elderly patients usually exaggerate," he would tell his colleagues. "Arthritis, back pain, typical senior complaints, not worth consuming too much time." When Charles was taken past the triage nurse to Dr. Richards' examination room, the doctor barely looked up from his computer. "Good morning, Mr. Dr. Richard took a quick glance at the patient chart. "Davis, what brings you in today?" "Doctor, I have this pain in my leg." Charles started, but Dr. Richards immediately interrupted. "Let me guess. Leg pain? Hip pain? Joint stiffness?" Charles nodded. "Yes, sir. My left leg. It's been getting worse for 3 months. Sometimes I can barely walk." Dr. Richards sighed internally. Another senior citizen with typical aging complaints. "Mr. Davis, how old are you?" 78, sir." "Well, there you go. At 78, joint pain is completely normal. Your cartilage wears down. Bones get stiff. It's part of aging," Charles tried to explain. "But doctor, this pain is different. It's not just stiffness. It's sharp, shooting pain. And sometimes my leg goes completely numb." Dr. Richards was already mentally moving to the next patient. "Mr. Davis, I see this every day. Seniors come in worried about normal aging processes. You need to accept that your body isn't 30 years old anymore." "Doctor, I understand I'm old, but let me do a quick examination." Dr. Richards stood up, spent exactly 90 seconds checking Charles's reflexes, barely touched his leg, and sat back down. "Everything looks normal for your age. I'm going to prescribe some ibuprofen for inflammation. Take it easy, maybe use a heating pad. This is just arthritis." Charles looked confused and disappointed. "Doctor, are you sure?" "Because the pain is right here." He pointed to a specific spot on his left thigh. "And it feels like something's pressing against my bone." Dr. Richards was clearly impatient now. "Mr. Davis, I've examined thousands of patients. This is textbook aging-related joint pain. There's nothing unusual here." "But doctor, I think there might be something—" "Mr. Davis," Dr. Richards interrupted, his tone becoming condescending. "I know you're concerned, but you need to trust medical expertise. Not every ache and pain needs intensive investigation. Sometimes the simplest explanation is the correct one." Charles felt dismissed and embarrassed. "I understand, doctor. Thank you for your time." Dr. Richards was already writing the prescription. Take these pills, rest, and if it doesn't improve in a few weeks, see your regular physician. Next. Charles left the examination room feeling worse than when he came in. Not just physically, but emotionally. He felt like his concerns had been completely ignored. But Jennifer Martinez, the head nurse who had been working at St. Mary's for 15 years, had been observing this interaction. Jennifer was experienced, thorough, and had developed excellent instincts about patients over her career. Something about Charles bothered her. Not his complaints. Those seemed legitimate. But the way Dr. Richards had dismissed him so quickly seemed wrong. "Dr. Richards," she said, after Charles left, "did you review Mr. Davis's complete medical history?" "Jennifer, it's a simple case. Elderly patient, joint pain, routine." "Doctor, I think you should look at his file more carefully." Dr. Richards was annoyed. "Jennifer, I don't have time to deep dive into every senior citizen's medical history. This is clearly age-related arthritis." But Jennifer was persistent. "Doctor, I'm pulling up his records now. This patient has been coming to our system for years, and there are some unusual entries." Dr. Richards was focusing on his next patient, but Jennifer continued reading. "Doctor, this says he has multiple foreign objects in his left leg, metal fragments, and there are references to combat injuries." Dr. Richards paused. "What?" Jennifer was reading more carefully now. "Dr. Richards, this patient is a Vietnam veteran. He has documentation of multiple combat injuries, 3 Purple Hearts, Bronze Star, Silver Star." Dr. Richards' attention was now fully on Jennifer. "It says here he was wounded 3 separate times in combat. The last injury was severe. Shrapnel from a mortar explosion embedded in his left leg and hip area." Dr. Richards felt his stomach drop. "Doctor, according to these records, Mr. Davis has been carrying metal fragments in his leg for over 50 years. The pain he's describing isn't arthritis. It's likely the shrapnel shifting or causing inflammation." Dr. Richards was now reading the medical records himself. What he saw made him feel sick. Charles Davis wasn't just any veteran. He was a decorated war hero. The record showed Purple Heart 3 times. For wounds received in combat, Bronze Star for heroic service, Silver Star for gallantry in action, Combat Medical Badge, Vietnam Service Medal, multiple documented combat injuries including shrapnel wounds, bullet wounds, and traumatic brain injury. But most importantly, there were detailed notes from VA doctors over the years documenting the ongoing issues with metal fragments in his left leg that could not be safely removed due to their proximity to major blood vessels. "Oh my God," Dr. Richards whispered. "Jennifer, I just told a decorated war hero that his combat injuries were normal aging." Jennifer looked at him seriously. "Doctor, this man didn't just serve his country, he bled for it, multiple times, and he's been living with war injuries for 50 years. Dr. Richards felt the full weight of his mistake. "I need to find him. Is he still here?" "He left about 10 minutes ago. But doctor, he'll be back. Pain like this doesn't just go away with ibuprofen." Dr. Richards spent the rest of his shift thinking about Charles Davis. How had he been so dismissive? How had he not taken the time to review the patient's history? How had he let his prejudices about elderly patients blind him to the possibility that this man's pain had a very specific, very serious cause? That evening, Dr. Richard did something he had never done before. He called the patient at home. "Mr. Davis, this is Dr. Richards from St. Mary's Hospital. I treated you this morning." "Yes, doctor. Is everything all right?" "Mr. Davis, I owe you a sincere apology. I didn't review your complete medical history this morning, and I realize now that I completely misdiagnosed your condition." Charles was quiet for a moment. "What do you mean, doctor?" "Sir, I now know that you're a Vietnam veteran with multiple combat injuries. The pain in your leg isn't arthritis. It's related to shrapnel that you've been carrying for over 50 years. You looked at my military records?" "Yes, sir. And Mr. Davis, I want to say something else. Thank you for your service. You're a decorated war hero, and I treated you with disrespect this morning. That was completely unacceptable." Charles was surprised by the doctor's call. "Doctor, you don't need to apologize. You were just doing your job." "No, sir, I wasn't doing my job. My job is to listen to patients carefully and investigate their symptoms thoroughly. I failed to do that because I made assumptions about you based on your age." Dr. Richards continued, "Mr. Davis, I'd like you to come back to the hospital tomorrow. I want to order proper imaging studies to see exactly what's happening with the metal fragments in your leg. And I want to consult with our orthopedic specialist and potentially get you referred to the VA hospital for specialized care." Charles was quiet for a long moment. "Doctor, are you sure? I don't want to be a bother." "Sir, you're not a bother. You're a patient who deserves the best care we can provide. And more than that, you're a veteran who sacrificed for our country. The least I can do is give you the medical attention you deserve." The next day, Charles returned to St. Mary's Hospital. This time, Dr. Richards was waiting for him personally. "Mr. Davis, thank you for coming back. I have a full team ready to properly evaluate your condition." The imaging studies revealed exactly what Jennifer had suspected. The shrapnel in Charles' leg had shifted over time and was now pressing against a nerve and causing inflammation in the surrounding tissue. What Charles had been experiencing wasn't aging-related pain. It was a legitimate medical condition that required treatment. Dr. Richards arranged for Charles to be seen by the best orthopedic surgeon in the area, Dr. Sarah Chen, who specialized in complex trauma cases. "Mr. Davis," Dr. Chen explained after reviewing his scans, "the metal fragments in your leg have moved slightly over the years. They're now pressing against your sciatic nerve, which explains the shooting pain and numbness you've been experiencing." "Can anything be done?" Charles asked. "Yes, absolutely. It's a complex procedure, but we can relieve the pressure on your nerve and significantly reduce your pain. It's not a simple surgery because of the location of the fragments, but it's definitely doable." Dr. Richards, who was present for this consultation, added, "Mr. Davis, I want you to know that all of your care will be coordinated between our hospital and the VA. You shouldn't have any out-of-pocket expenses for this treatment." Charles was overwhelmed. "Doctor, this is more than I ever expected." Dr. Chen smiled. "Mr. Davis, you earned this care. You earned it 50 years ago when you put your life on the line for our country." The surgery was scheduled for the following week. Dr. Richards made sure he was present in the operating room, not because he was needed medically, but because he wanted to witness the conclusion of the case he had initially handled so poorly. The surgery was successful. Dr. Chen was able to relieve the pressure on Charles's sciatic nerve without disturbing the major blood vessels near the shrapnel. During Charles's recovery, Dr. Richards visited him every day. "Mr. Davis, how are you feeling?" "Much better, doctor. The pain is almost completely gone." "I'm so glad to hear that. And Mr. Davis, I want to ask you something. Would you be willing to speak to our medical residents about your experience?" Charles looked puzzled. "What do you mean?" "I mean, Would you be willing to share your story with young doctors? I think it would help them understand the importance of taking detailed patient histories and not making assumptions based on age or appearance. Charles considered this. If you think it would help, I'd be happy to. A month later, Charles Davis spoke to a group of medical residents at St. Mary's Hospital. Dr. Richards introduced him. This is Mr. Charles Davis. A month ago, I made one of the biggest mistakes of my medical career. I dismissed his legitimate pain complaints as normal aging without bothering to review his medical history. Charles took over the presentation. Doctors, I want you to know that I don't hold any grudges about what happened. Dr. Richards made a mistake, recognized it, and corrected it. That's what good doctors do, he continued. But I want you to understand something. I spent 3 tours in Vietnam. I was wounded 3 times. I've been carrying pieces of metal in my body for over 50 years. When I came to the hospital in pain, it wasn't because I was a complaining old man. It was because something was legitimately wrong. One of the residents raised her hand. Mr. Davis, how did it feel to have your concerns dismissed? Charles thought carefully. It felt like my service didn't matter. Like the sacrifices I made for my country were invisible. But more than that, it felt like I wasn't being heard as a human being. Dr. Richards added, Mr. Davis's experience taught me that every patient deserves our full attention and respect, regardless of their age, appearance, or our assumptions about their condition. Another resident asked, what should we do differently? Charles answered, take time to listen. Read the medical history. Ask questions. And remember that everyone has a story. You never know who might be sitting in front of you. Dr. Richards concluded the presentation. Mr. Davis is a decorated combat veteran who has served our country with honor. But even if he wasn't, even if he was just a regular 78-year-old man with leg pain, he would still deserve our complete attention and respect. Every patient does. After the presentation, several residents approached Charles to thank him and to ask more questions about his military service and his medical experience. One young resident, Dr. Amanda Foster, said, Mr. Davis, thank you for sharing your story. I promise I'll remember it every time I see an elderly patient. Charles smiled. Doctor, just remember to see the person, not just the age. 6 months later, Dr. Richards had implemented new protocols in the emergency department. All patients over 65 now received automatic comprehensive medical history reviews. Additionally, the hospital created a veteran identification system to ensure that military veterans received appropriate recognition and care. Charles's recovery was complete. His pain was gone, and he was walking normally again. But more importantly, his experience had changed how an entire medical team approached patient care.